You so much for organizing this. And hello, everybody. Welcome. Bonjour. I'm the project director, and I'm going to give you just a bit of context. And this presentation will be mostly about the project and the kind of the network and the themes that we're interested in. And there won't be much specific like research findings and methodology, but you're very welcome to ask any questions if you want us to tell you more about. And we've kept the presentation short so that we can just have a discussion and tell you about what we're doing based on this. And I'm very happy that we have lots of team members here, and Serge Caparros and Jean-Pierre and Blaise who work in the DRC, and Serge is in France. So anyway, let's dive in. Thank you for being here. We're very excited to tell you about our project. Right, Chantal, can you go to the next slide, please?
Okay.
Great. Okay, wonderful. Thank you, Chantal. So the project is mostly francophone. So the name is an acronym that is based on our research interests. So Psycavi is based on Psy for psychological consequences. The CA is for conflit armé, so armed conflicts, and VI for intergroup violence. So these are the main, well, it define the main things that we're interested in. And you can go to the next slide, and I can say that, so this topic of the psychological consequences of being exposed to violence and armed conflicts is certainly of interest and to many people. Our specificity, Chantal, you can go to the next slide.
I'm trying. I don't know. It's not allowing me to move to the next.
It's not allowing you to move to the next slide.
That's strange.
Do you want me to share my screen if you're having? Okay, there you go.
Okay.
That worked.
Okay,
so I wanted to just highlight the fact that we've been working initially in Rwanda and now also in the Democratic Republic of Congo, particularly in North Kivu with Blaise and Jean-Pierre, for instance, and as well in South Kivu, so two provinces that have been plagued by instability. And of course, our interest in Rwanda was initially to look at the consequences on the population of the 1994 genocide of the Tutsis, and gradually our interest we zoomed out because the whole region has really experienced a lot of instability and violence, not only, but in large part as the ripple effects and the consequences of this event have really been regional. Anyway, so we have this focus on the Great Lakes region, though the Great Lakes can be defined like as much more broadly, but our focus has been in Rwanda and the DRC. And the other, I guess, distinctive feature of our project is that there's been a lot of focus on mental health following exposure to such events, and rightly so. But much less interest has been focused on cognitive functioning, and that's certainly an aspect that we're very interested in and that we bring as a distinctive feature. Okay, let's try to go to the next slide. Hope that it works. Chantal.
For some reason, it's not going as smoothly. Oh, God.
There we go. Oh, yeah, perfect.
Okay.
Okay, I'm sure I probably don't need to justify this to you, but in psychology, if you're interested in trauma, there's a lot of research on trauma, but it's very much focused on the north. And as you can see in these two geographical distributions, exposure to violence and insecurity is not distributed equally across the globe. And though most research is done in the north, that's actually, populations in the south are more exposed to violence and insecurity. And so in one of the accounts, see, I'm pointing to the globes there, you have a mapping of all the violent incidents that have resulted in at least one death. And you see that there are very few of those in the country where I live in Canada, but there's a concentration of such events in certain regions in Africa. On the other map, what you have is a grading of insecurity by country. And of course, the red areas are where the countries are less stable, where people experience more violence. And you see that there's a concentration of that in certain areas, particularly in Africa. Okay, so the repercussions of this on mental health, I mentioned, are very much of interest. And we can estimate the worldwide prevalence of post-traumatic stress disorder, which is one of the important consequences of such events. So worldwide, it's about 4 to 6% of the population that has a clinical PTSD. But in studies that have focused on people exposed to war and armed conflicts, the prevalence is more like about 26%, which is extremely high. And this aligns with what we find in our studies. So you can see percentages in Rwanda, depending on the years, but there are still very high number of years after the 1994 genocide. And current levels in the DRC and North Kivu in particular are also about that rate. And I want to mention another thing is that most of the things we know about the psychological consequences of exposure to war and armed conflicts comes from studies of refugees who have found refuge in a safe context in the north, because that's what researchers easily have access to. But by and large, most of the population or the people exposed to armed conflicts are not have not migrated to European or North American countries and have stayed in the South. And we have very little knowledge of these particular samples. Okay, sorry, I'm taking way too long. Chantal, next slide, please. This is just to give you like the general context in which
Please bear with me. For some reason, my arrows to move to the next slides are not working as I would like them to.
There we go. I think I've already mentioned that, so we can probably go to the next slide. But just as I said, the project started out very, very small with just 2 people and $500. Serge and I went to Rwanda, made contact with Eugène, a colleague in Rwanda, met Chantal in one of our first trips. So it started out very, very small, but this has been growing for 10 years now. And this is one of the issues that we've talked about in AfriBCD meetings, and I think is important to highlight here, is the importance of having the time and the opportunity to build long-term collaborations and research partnerships, because though it started out very small, having that longevity has allowed us to create the project that Chantal will talk about, which is fairly substantial. But I wanted to highlight that prior to this project, we have done a number of studies, initially in Rwanda, that have highlighted certain things that we found that are important. So one of the first things that we see is that in Rwanda, even 25, even now 30 years after the events, you can still see, obviously, mental health consequences, but also cognitive consequences of these events. So the exposure to violence in 1994 has correlates in terms of working memory function, for instance, and abstract reasoning ability, so that there is a link between the exposure to these potentially traumatic events and current cognitive functioning, so long-term consequences. Another thing that we've been studying, and this is Anna's work, is how the nature of trauma memories, and that's really important to see how these events shape the structure of the memories that people have, and that still have an important impact on their day-to-day lives. So a lot of people still suffer from intrusions even 25, 30 years after the events, their memories are still impacted on a daily, weekly, or monthly basis. Serge has written an important paper on the cognitive correlates of attitudes towards reconciliation. And I think that's also another angle of doing this work that is very important, is that we realize there's a relationship between mental health, attitudes towards reconciliation, and cognitive functioning, so that studying how this works has important impacts for peace building and how societies transition after violence towards more stable and hopefully better context. And we've also studied how, in Rwanda, the gacaca is a system of transitional justice that was really a very big endeavor, and that many people participated in these community tribunals after the events for a number of years, and studying the impact of either participating or being a witness in these events, how that impacts mental health and attitudes towards reconciliation has also been a focus. Okay, Chantal is a specialist on intergenerational transmission of trauma, but also with looking at attitudes towards reconciliation. That's really important. And so these are studies that we did in Rwanda, but we've also focused more recently on North Kivu, where with the help of Blaise, Jean-Pierre, and other partners there, we've been able to access people who live in really highly stressful circumstances. So we've studied populations of people, for instance, displaced because of armed conflicts, natural catastrophes, volcano eruptions. There's a lot of instability and sources of threats that have an impact, again, and this is short-term consequences on cognitive, working memory, reasoning, but also day-to-day functioning. So when we study how people are impacted in their day-to-day life, we see links there. And I want to mention another topic that's been of interest and that a student has been working on. We know that this region in North and South Kivu, unfortunately, sexual violence, rape is highly prevalent and is a very important issue to study. And obviously there are mental health consequences of this, but ONET is also documented cognitive consequences and specifically examining is there something special about rape? I mean, does this event have a specific kind of consequences? And the short answer is yes. And so it's very important to try to understand these consequences. Sorry, I've taken way too long, and now I'm very happy to hand over to Chantal.
If my slides allow me to go to the next one.
Good luck.
Don't worry, it's the nature of Zoom meetings to have a few technical problems. So
very strange. You know, I have to go forth and back. Okay. Hello, everybody. Bonjour. Thank you very much for having us. I wish I could see everybody's face, but I can't. I'm hoping maybe during the question and discussion sessions, I will get to see more people. So I'm going to talk more specifically about the Observatory project. So it is a project that has been funded by the Social Sciences and Humanities Research of Canada over a period of 7 years. And it is an international network that brings together 7 partner organizations based in Rwanda, Democratic Republic of Congo, France, and Canada. And it includes 14 researchers with a wide range of backgrounds, and I will talk about that a little bit later. So this is the second year of implementation of the project, and the project has 4 sites, one in Rwanda, in Goma, which is the northern Kivu province of Congo, Bukavu, which is the southern Kivu, and here in Quebec. So the overall objective of the project is to identify, mobilize, develop and mobilize scientific knowledge regarding the psychological consequences of armed conflicts and mass violence on civilian populations. So before talking about the activities and the research program, I would like to start by telling you more about the team. So as you now know, Isabelle is the director and the principal investigator on this project. We have Professor Habimana, who is a co-director and a specialist in psychopathology and intercultural psychology. We have Serge, who is here with us today, whose expertise is in cognitive psychology, and he has worked on trauma also in Rwanda and Congo. We have Professor Rutembesa from Rwanda, who has been working with the survivors of the genocide. Excuse me. We have other researchers like Professor Atem, who is a professor of public health with expertise in gender issues. We have Dr. Ndushabandi, who is a political scientist and has been working on democracy and peace building in post-conflict settings. We have Kosiga, who is a clinical and health psychologist. We have Dr. Masika, who has been working on trauma recovery and resilience in Congo. We have another group, for instance, Professor Leanza is a specialist of cross-cultural psychology. We have Batenga, who is a clinical psychologist and has been working on treatment of PTSD in Northern Kivu. We have Professor Bourbo, who is an expert in international relations, migration, and resilience at a population level. We have Professor Mukamana, who is a professor of mental health nursing and has been working in Rwanda with women who survived sexual violence during the genocide. So as you can see, that there's a wide range of backgrounds, and this was intentional because there was a willingness our purpose is to bring a multifaceted perspective on the issue of armed conflicts and how they impact how they impact civilian populations. So apart from the team of researchers, we also have a local team of coordinators at each site. And we have Blaise and Jean-Pierre, who are with us today. So we have Miracle, who is at Bukavu office, and Françoise, who is in Kigali. And they play a key role in the implementation of daily activities, such as recruiting and training research assistant and overseeing data collection activities and networking with local organizations as well. So I will come back to our collaboration with the local organizations later. Last but not least, we have a team of very dynamic postgraduate students who work on different topics that are in line with our research focus. For instance, like Isabelle mentioned, there is Oneti Kasali is working in northern and southern Kivu, and his project is looking at the impact of sexual violence, especially rape, on the mental health and cognitive functioning of women who survived those events. We also have Justine Cinq-Mars, who is working here in Quebec, and her project is looking at the impact of trauma exposure and post-migration stress on neurocognitive functioning of refugees. And we also have Jean Bertrand, who is in Rwanda, and Richard Bagabo, who is looking at displacement and its impact on social and psychological functioning as well. Now, I will go to activities per se. So we have quite a number of activities which are geared toward fulfilling the mission of the observatory. So one component of activities is related to monitoring what is going on in terms of relevant research. So we monitor scientific literature regarding the psychological impact of armed conflicts, mass violence on psychological functioning. Another element that we monitor is the socio-political and security indicators, especially in the regions in which we work. Another group of activities, of course, it's research, because we want to understand those impacts and the application of a multidisciplinary approach to different scientific studies that we are conducting or we plan to do later. Third group of activities, it's a training of students and knowledge mobilization, where we want to make sure that research findings are disseminated among decision makers, practitioners, community leaders, and the public at large. We also have activities of raising awareness about the devastating consequences of mass conflict and armed conflicts on civilian population, and that we want to do it at an international level. So if I come back to research, since this is a primarily research project, so our research focus has three main lines. So the first line of research aims at providing a portrait of psychological health among trauma-exposed population, and this is going to be done by conducting longitudinal epidemiological study. I will talk about them a little bit more later. The second line of research is on sexual violence. So we want to understand further the consequences of sexual violence perpetrated mainly against women. Another element is to understand how the participation in transitional justice affect the mental health of people who participate in those processes. As you may know, it was the case in Rwanda, but now in DRC, sometimes perpetrators of war crimes are tried, and victims are called upon to give testimony as a part of the prosecution process. So we want to understand how that affected their mental health and cognitive functioning. The third line of research is to look at the impact of literacy programs and francisation programs on affective and cognitive health. Once again, in Africa, in Rwanda and DRC, there are non-government organizations have literacy programs for vulnerable war-affected groups of people. And here in Quebec, there are like French programs for refugees. So those are primarily designed to improve the living conditions of participants, the integration, for instance, in Quebec, for the literacy programs for people to be able to improve their ability to earn a living. But we want to see if those programs have also a psychological impact, apart from the socio-economic primary objective. Now, coming back to the longitudinal epidemiological studies I was talking about. So the purpose of these studies is to examine the consequences of trauma exposure and diversity on mental health and cognitive functioning, and will be conducted primarily in Africa, so in Rwanda, in Northern Kivu, Southern Kivu, and the objective is to recruit 1,500 members of the general population and 300 university students at each site. We intend to measure quite a number of variables, such as, so in the block of trauma, we have trauma exposure, measures of human insecurity, the social determinants of health. We will measure psychopathology and mental health problems, especially post-traumatic stress disorder, depression, anxiety, traumatic grief, and so on. We will also look at cognitive functioning. We will measure cognitive difficulties in performing everyday life tasks. We will look at short-term memory and executive functioning. Sorry. There are also other variables such as intergroup attitudes and reconciliation, community integration, resilience. We will also have a qualitative study or a qualitative component which aims to explore the cultural perception and representations about mental health. Now, as I said, so these studies will be longitudinal, and we will, so the first data collection is planned in 2024. It's starting in a couple of weeks, and we will measure all those variables at the second time, but that will depend on a change in sociopolitical indicators. As I said, we monitor those indicators on a regular basis. So those indicators are, for instance, renewed conflicts, renewed fighting, displacement of populations, food insecurity, unemployment rates. So we want to see whether a change in these indicators at a societal level, if it is reflected in the psychological health of the population. So the second time point is tentatively in 2026, but like I said, it will depend on whether we notice a change in those indicators. And there is a last data collection planned planned in 2029. So apart from research activities, we have also other activities, like I said before. for instance, in last year, which was the first year of implementation of the project, we had a members workshop in Kigali where all the members of the observatory were together to discuss about research, such as the variables to be measured, the tools that we use, how to actually, the logistics of it. We also discussed about the socio-political and security indicators that are relevant for each site. Members also discussed about the best strategies to make sure that once we have the results, we are able to disseminate it. So the knowledge mobilization strategies. We also had a scientific day where we had our members, but also local researchers, local different organizations. So we presented our research at the local, sorry, the local community, the local organizations presented their work, as well as the local researchers. And a second objective of this day, apart from sharing the research findings, was to build a genuine dialogue between practitioners and researchers, because we wanted a real exchange of ideas. Practitioners can benefit from research findings, and researchers can get ideas from people who are on the ground. So that is it in terms of activities. I would like to acknowledge our partners, Université Laval, Université de Goma, Université du Rwanda, Université Paris 8, Centre de recherche cerveau, Centre multiethnique de Québec, la Fondation Panzi, ICAR et l'Institut de recherche et de dialogue pour la paix. Apart from these official partners, we also have many inspiring local organizations that we collaborate with on a daily basis. So that is it. Feel free to contact us if there are things that you are interested in or things we can share. So our contacts are available. And I thank you very much for your attention. So questions, comments, suggestions are most welcome. Thank you.